Welcome to Prudent Health Hub, your trusted source for health information. Today we're diving deep into a serious global health issue, tuberculosis, commonly known as TB. Stay tuned as we explore its causes, symptoms, treatments, and prevention strategies. What is tuberculosis? Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs but can spread to other parts of the body, such as the kidneys, spine, and brain. TB is a major public health problem worldwide, with millions of new cases each year. History and global impact. TB has been a human affliction for millennia. Ancient skeletal remains show evidence of TB infections. In the 19th and early 20th centuries, it was one of the leading causes of death. Despite advancements in medical science, TB remains a significant health challenge, particularly in developing countries. According to the World Health Organization, TB is one of the top 10 causes of death worldwide. Transmission and risk factors. TB is an airborne disease, meaning it spreads through the air when an infected person coughs, sneezes, or talks. When someone inhales these bacteria, they can become infected. However, not everyone who gets infected will develop active TB disease. Some people may only have latent TB, where the bacteria remain inactive in the body. Several factors increase the risk of developing active TB. 1. Weakened immune system. Conditions like HIV/AIDS, diabetes, and certain cancers can weaken the immune system, making it easier for TB bacteria to multiply. 2. Malnutrition. Poor nutrition can weaken the body's defenses against TB. 3. Substance abuse. Alcohol and drug abuse can compromise the immune system. 4. Close contact. Spending time with someone who has active TB increases the risk of infection. 5. Living conditions. Overcrowded and poorly ventilated living conditions, common in some parts of the world, facilitate the spread of TB. Symptoms of tuberculosis. Recognizing the symptoms of TB is crucial for early diagnosis and treatment. Common symptoms include: 1. Persistent cough. Cough lasting more than 3 weeks, often with blood in the sputum. 2. Chest pain. Discomfort or pain in the chest, especially when breathing or coughing. 3. Weight loss. Unexplained weight loss and loss of appetite. 4. Fever and chills. Persistent fever, often with night sweats. 5. Fatigue. Feeling weak and tired most of the time. In cases where TB affects other organs, symptoms can vary. For example, TB of the spine may cause back pain, while TB of the kidneys might cause blood in the urine. Diagnosis of tuberculosis. Diagnosing TB involves several steps and tests. 1. Medical history and physical exam. The doctor will review your symptoms and medical history and perform a physical exam. 2. Skin test, also known as Mantoux test. A small amount of tuberculin is injected under the skin. A raised bump at the injection site after 48 to 72 hours indicates TB exposure. 3. Blood tests. These tests measure the immune system's response to TB bacteria. 4. Chest X-rays. X-rays can reveal abnormalities in the lungs that suggest TB. 5. Sputum tests. Samples of sputum are examined under a microscope and cultured to detect TB bacteria. Treatment of tuberculosis. Treating TB requires a combination of antibiotics over an extended period, typically 6 to 9 months. The standard treatment regimen includes: 1. Isoniazid INH. Kills active TB bacteria. 2. Rifampicin RIF. Prevents the bacteria from reproducing. 3. Ethambutol EMB. Stops the growth of bacteria. 4. Pyrazinamide PZA. Works best in acidic environments, like those within TB lesions. It's crucial to complete the entire course of treatment to avoid drug resistance, which can lead to multi-drug-resistant TB-MDR-TB and extensively drug-resistant TB-XDR-TB-XDR-TB. These forms of TB are more difficult and costly to treat. Prevention of tuberculosis. Preventing TB involves several strategies. 1. Vaccination. The Bacillus Calmette-Guerin BCG vaccine provides some protection against TB, especially in children. 2. Public health initiatives. Screening and treating latent TB infections, particularly in high-risk populations, can prevent the development of active TB. 3. Infection control measures. Ensuring proper ventilation, using protective masks, and maintaining good hygiene in healthcare settings can reduce the risk of transmission. 4. Education and awareness. Raising awareness about TB symptoms and the importance of completing treatment can help control the spread of the disease. Challenges in TB control. Despite efforts to control TB, several challenges remain. 1. Drug resistance. The emergence of MDR-TB and XDR-TB complicates treatment and control efforts. 2. HIV co-infection. People with HIV are more susceptible to TB, and managing both conditions simultaneously is challenging. 3. Healthcare infrastructure. In many developing countries, inadequate healthcare infrastructure hampers effective TB diagnosis and treatment. 4. Stigma and discrimination. TB patients often face stigma and discrimination, which can deter them from seeking treatment. Recent advances and research. Research into TB is ongoing, with several promising developments. 1. New drugs. Researchers are developing new drugs and treatment regimens to combat drug-resistant TB. 2. Vaccines. Efforts are underway to develop more effective TB vaccines. 3. Diagnostic tools. Improved diagnostic tools, such as rapid molecular tests, can detect TB more quickly and accurately. 4. Treatment strategies. Shorter and more effective treatment regimens are being tested to improve patient outcomes. Tuberculosis remains a significant global health challenge, but with continued efforts in research, treatment, and prevention, we can make progress in controlling and eventually eliminating this disease. Remember, early detection and treatment are crucial, so if you or someone you know exhibits symptoms of TB, seek medical attention promptly. Thank you for tuning in to Prudent Health Hub. We hope you found this video on tuberculosis informative. For more health tips and updates, make sure to subscribe and hit the notification bell. Stay informed, stay healthy, and we'll see you in the next video.